Are UK public institutions teetering on the brink of collapse? A question that unfortunately is becoming increasingly relevant in today's socio-political climate. You see, these institutions, pillars of society, are under immense pressure. They are grappling with a myriad of issues, from financial strain and overworked staff to seismic policy changes. Let's take a moment to consider the National Health Service, or NHS, as it is more commonly known. This beloved institution, once the envy of the world, is now under an alarming amount of strain. It's not just about budget cuts or pandemic-related issues. It's about systemic changes and decisions that have led us to this point. It's about the people who tirelessly work within these institutions, their dedication often overshadowed by the mounting challenges they face. So, what's causing this crisis? Is it a result of austerity measures? Or is it a symptom of a larger societal issue? And more importantly, what does this mean for the future of the United Kingdom? Let's delve deeper into the crumbling state of these institutions, taking the NHS as a case study. The NHS, a beacon of public service, now finds itself in critical condition. This national treasure, once the pride of the United Kingdom, is grappling with issues that threaten to undermine its very foundations. Let's begin with the elephant in the room: waiting times. In the past decade, we've seen these times skyrocket. It's not uncommon for patients to wait weeks, even months, for crucial treatments and surgeries. This isn't just an inconvenience, it's a matter of life and death. Then we come to the issue of staff shortages. The NHS is a machine, and its gears are its employees. But as the years roll on, we're witnessing a worrying trend. Nurses, doctors, and other healthcare professionals are leaving the NHS in droves. The reasons vary, from poor pay to intense workloads, but the result is the same: a healthcare system that's stretched to breaking point. Adding fuel to the fire, we have the ever-looming spectre of budget cuts. The NHS, like any public service, relies on funding to operate. But over the years, this funding has been whittled down, leaving the NHS to do more with less. This has led to a scenario where the NHS is forced to make difficult choices, often at the expense of patient care. To paint a picture of the scale of the problem, consider this. In the last 5 years alone, the NHS has seen a decrease in real terms funding of nearly £2 billion. That's equivalent to the annual budget of several NHS trusts combined. These factors, waiting times, staff shortages, budget cuts, they're not isolated issues. They're symptoms of a broader, systemic problem. A problem that threatens to bring the NHS, a cornerstone of the UK's public services, to its knees. Against this backdrop, let's examine the impact of Rishi Sunak's policies. Rishi Sunak, the Chancellor of the Exchequer, has introduced policies that have stirred controversy. Now let's delve deeper into this. Sunak's policies were launched with the intention of spearheading economic growth. However, the impact on public institutions, particularly the NHS, has been a topic of heated debate. Some laud Sunak's focus on technological advancement and green initiatives. The Rethink X report, for instance, suggests that the transition to a post-carbon economy could happen faster with the right support from governments and corporations. Sunak's policies, like funding for electric vehicles and precision fermentation, align with this vision, indicating a forward-thinking approach. However, critics argue that these policies overlook immediate concerns. For instance, the NHS, already strained by the pandemic, has been grappling with budgetary constraints. Critics suggest that Sunak's fiscal policies, while futuristic, do not adequately address the urgent need for funds in healthcare. The focus on long-term economic growth, they argue, should not come at the expense of present-day public health needs. Furthermore, Sunak's policies have also been scrutinized for their potential impact on public sector pay. Critics argue that wage restraint in the public sector, a key feature of Sunak's fiscal approach, could further exacerbate the challenges faced by institutions like the NHS, where staff shortages and low morale are already pressing concerns. On the other hand, supporters of Sunak's policies argue that fiscal restraint is necessary in these challenging economic times. They contend that careful budgeting and prioritization of spending are essential to ensure the country's financial stability. This debate underlines the complexity of balancing immediate needs with long-term goals. It also underscores the importance of careful policy-making, where the impact on all sectors, including vital public institutions like the NHS, is thoroughly considered. It's clear that these policies have played a significant role in the current state of public institutions. As we continue to navigate these challenging times, the role of policies like those introduced by Sunak will undoubtedly remain a hot topic of debate. The strain on public institutions like the NHS has far-reaching implications. The ripple effects of this crisis are not confined to the corridors of hospitals or the clinics of general practitioners. They pulsate through every facet of our lives, touching every citizen of the United Kingdom. Imagine for a moment you or a loved one needed a critical medical procedure. The clock is ticking, but so is the waiting list. Increased wait times for medical procedures, a direct consequence of the strain on our health services, could mean a delay in life-saving treatments. It's a grim reality that many are facing today. The strain doesn't stop at healthcare, it ripples out, touching other public services. Schools under pressure, unable to provide the quality of education our children deserve. Public transportation, struggling to meet demands, causing delays and disruptions. Social care stretched thin, leaving our most vulnerable citizens at risk. And then, there's the potential for increased tax burdens. In a bid to salvage crumbling institutions, the government's hand might be forced to dig deeper into the pockets of its citizens. The average Briton could end up shouldering the cost of this crisis, a cost that might be too steep for many. But it's not just about money, it's about the fabric of our society. The trust we place in our public institutions, the belief that they will be there when we need them, is being eroded. This crisis is shaking the very foundations of our social contract. The situation is dire, but is there a light at the end of the tunnel? As we stand on the precipice, what does the future hold for UK's public institutions? The answer is not set in stone, but rather, it's in our hands. The future of our public institutions can be bright, but it requires a collective effort, a renewed commitment to policy reform, increased funding, and improved management. Picture this: a future where our institutions, like the NHS, are not just surviving, but thriving. To achieve this, we must first address the immediate funding crisis. Increased funding can help to alleviate the current strain on resources, ensuring that institutions can deliver the high-quality services that we all rely on. But it's not just about throwing money at the problem, it's about investing wisely, ensuring that every pound is used effectively to bring about real, tangible improvements. But money alone won't solve the problem. Policy reform is equally crucial. We need policies that are forward-thinking, that anticipate future challenges and prepare for them. Policies that put people first, prioritizing the needs of the many over the interests of the few. Rethinking our approach to public institutions is not just about fixing what's broken, it's about creating something better, something that serves us all more effectively. Better management is the third pillar in this trinity of change. Our public institutions need leaders who are not just competent but visionary, who can guide these institutions through difficult times and lead them towards a brighter future. Leaders who are accountable, who listen to the voices of those they serve, and who are committed to the public good. And finally, we must not underestimate the power of public support. When we stand together, when we raise our voices, when we demand better from our institutions and those who lead them, we can bring about change. The future of our public institutions is not just in the hands of policymakers and leaders, it's in our hands too. The fate of UK's public institutions hangs in the balance. It's time for action, before it's too late. We are at a crossroads, and the path we choose now will determine the future of our public institutions, and in turn, the future of our country. Let's choose wisely. Let's choose a future where our public institutions are strong, effective, and truly serve the public good.